Welcome to the Holistic Psychiatry Podcast. I'm Courtney Snyder, a physician and holistic adult and child psychiatrist. In this and the next two podcast episodes, I will be discussing mold toxicity. This is a very common root cause to brain-related symptoms and can contribute to anything from depression, anxiety, panic, obsessions, compulsions, inattention, mood swings, and even psychosis. So hallucinations and delusions. It is also a common culprit in autism and in dementia. In addition, mold toxicity is a deeper root cause to many of the other root causes of brain-related symptoms. I often think of it as the root of the roots. It can contribute to mast cell activation, which relates to inflammation, elevated pyrroles, copper-zinc imbalances, and endomethylation, all of which relate to nutrient imbalances, oxidative stress, which relates to toxicity, food sensitivities, autonomic dysfunction, which relates to the vagus nerve, and susceptibility to things like candida overgrowth, Lyme, and its co-infections, as well as viruses. It can also contribute to sensitivity to electromagnetic fields, or what we call electromagnetic hypersensitivity. As you can see, one of the challenges of discussing the emerging research into root causes is that everything is interconnected. The best I can do is to discuss these topics separately and try to point out where these dots connect. I have previous podcasts on each of these topics. In this episode, after giving some general historical context and discussing where things are generally in both conventional and functional medicine, I'll address the following questions. What are 3 types of mold-related illness? How do we become mold toxic? What is mold colonization? Is everyone susceptible? Do mold toxins stay with us even when we are out of water-damaged environments? What are the brain and body symptoms? And diagnoses can be due to mold toxicity. So first, I should say that mold toxicity is not something that's generally taught in medical school, and it's not considered a big player when it comes to conventional medicine and psychiatry. The original pioneer in this area is Dr. Richie Shoemaker, and he wrote the book called Mold Warriors and has had subsequent books as well. And he found that biotoxin illness was creating a lot of symptoms for people. Now, at the time, he was looking at a biotoxin that was not a mold toxin, but nonetheless, his work translated and moved on to mycotoxin is the name of mold toxins. And the medication that he was finding to be extremely impactful was cholestyramine, an older cholesterol medication. But his discoveries were built upon by the work of Dr. Neil Nathan and Dr. Joseph Brewer. And my own approach to mold toxicity is very much influenced by the work of Dr. Neil Nathan, as he has been my mentor. And this is since I discovered that I had mold toxicity myself as a primary driver to many of my own symptoms. Their approach differs from Dr. Shoemaker in that they test for mycotoxins directly in the urine, whereas Dr. Shoemaker's approach was to look for, and is to look for, biomarkers. So these would be blood tests that would look for inflammatory markers that aren't generally tested for that could point to mold toxicity. However, there are other biotoxins that could also be causing those markers to be elevated. But our approach, and when I say our, I mean, again, Neil Nathan and how I do things, is to check for urine mycotoxins. Another difference is that Dr. Shoemaker's approach relies more heavily on the use of cholestyramine, whereas the work of Dr. Nathan and Dr. Brewer is to use binders that are more targeted to the specific mold toxins that are showing on the urine mycotoxin test. And though Dr. Shoemaker wrote Mold Warriors in 2005, and then he and, again, Drs. Nathan and Dr. Brewer have been treating mold toxicity for many years, it didn't really start to come onto the scene in terms of functional medicine understanding until the last 3 to 5 years. And when I started to learn about it, it wasn't even offered as a topic in most functional medicine conferences. And now you will see conferences dedicated to mold toxicity, multiple conferences. So the number of doctors that are gaining awareness in the functional medicine community has certainly grown substantially. That doesn't mean, however, if someone goes to their conventionally trained doctor, that they are going to have any sense or appreciation of how this could be contributing to their symptoms. Unless, of course, that's a physician who's particularly open and humble and willing to always learn new information. So I'd like to comment on what 3 types of mold-related illness there are, because they often get confused. First, there's mold allergy, and that's what most people have a general sense of. Just like any other allergy, immune symptoms can be triggered, usually in the form of upper respiratory symptoms, so runny nose, sneezing. That, however, is not necessarily due to mold toxicity. Mold toxicity relates to the acquisition of mold toxins, typically from water-damaged spaces. So the molds that we're allergic to out in the environment, if we are allergic, those molds outside have checks and balances. It's the molds that grow in contained spaces within buildings that are spewing off particular toxins. And they are often different families, although there is some overlap. We could be acquiring mold toxins in an environment, and there's not necessarily going to be a smell. There can be, and that can certainly be a red flag, but there's not always a smell. So mold toxins are on the spores that are in the air and can then be inhaled. And the toxins within the body, because these particular toxins are ionophores, meaning they have a positive charge at one end and a negative charge at another end, they can easily cross tissue barriers. With that, they can impact various parts of the body. And they go from the body into the liver, into the gallbladder. And in the gallbladder, they're attached to bile salts. On the bile salts, they're put into the gastrointestinal tract from the gallbladder, and from there are reabsorbed with the bile salts. So, but for interrupting that process, which I'll be talking about when I discuss treatment, those mold toxins don't necessarily go anywhere. So this is part of why recognizing when someone has mold toxicity and using appropriate treatment interventions is so important. Because simply getting out of a mold toxic environment doesn't necessarily mean the toxins are going to be going out of the person. The third type of mold-related illness is what is called mold colonization. And this is where the mold spores, again, which have the toxins on them, can be inhaled and can colonize the sinuses. And from there, just if you think about drainage from the sinuses, they can also go into the gastrointestinal tract and cause colonization there. So how does one become mold toxic? There's 2 primary variables. One is a seeming genetic vulnerability. And it's thought that 25% of people are genetically vulnerable. And while there is specific testing called HLA testing, that is testing that comes out of the work of Dr. Shoemaker, we haven't all found that testing to be particularly useful. I have certainly seen many individuals who had mold toxicity that did not have the genes that have been suggested to be related. And I've seen people who have had those genes and have not developed mold toxicity. It's an important point here because many people will contact me and be certain that they have what they would call the dreaded gene. And from my standpoint, again, this particular testing is not clinically useful. However, I do find it to be scary for people and give them a sense of hopelessness about their medical condition. With or without this gene, we see people benefiting significantly from treatment for mold toxicity. And I don't do this type of testing, though I did early on before I, again, found that it wasn't clinically useful in my practice. So if not everyone is vulnerable, and I should say, there is a belief that if anyone gets enough exposure, that they will become toxic. However, 25% appear to not mount an immune response and become much more easily toxic. So within a household, you could have a couple of family members who are becoming sick and then other family members who are not. So I always hear people say, well, no one else was sick in the family, suggesting that then it couldn't be mold, but that's not actually the case. We used to say that it was estimated that 50% of buildings had water damage, and now I would agree with many mold and environmental inspectors who say it's closer to 75 to even 100%, some would argue. And again, where there is water damage and retains moisture, there is an ideal medium for toxic mold to grow rapidly and produce spores which carry toxins. It isn't just the infamous black mold or Stachybotrys that is the problem. Aspergillus, Penicillium, Fusarium, Chitonium. These molds also make toxins that can be inhaled. Mold in buildings is often not visible. It can be in a crawl space, an attic, behind a wall, under a sink. It can be within a component of the air conditioning system or even the ductwork. The spores disseminate easily. They don't necessarily, for example, stay in a damp basement. So if you consider approximately 25% of people being especially vulnerable, and at least, but likely more, 50% of buildings having water damage, then there are a lot of people who are unknowingly becoming toxic while spending time in affected homes, but also schools, workplaces, cars, dorms, nurseries. And when you consider the masses of people